Hi, I'm Erin Ballard, owner of Family Solutions and Wellness Center and one of our therapy intensive clinicians here. What is a therapy intensive? Well, there's a lot of different ways that this can be conducted. Different practices do it differently. Some do 1 day, 2 days, or 3 day options. But here we do 2 day options. We have two therapists work with you in your relationship or your family. So this is for couples or families. And we have about 10 to 11 hours of in person work, but a 20-hour package. So what you would do is if we decide we're a good fit, we would schedule that intensive for about 3 weeks out. And during that time, you all get one on one consultation calls so we can better understand what's going on and what you want to get out of the experience. We send some assessments and get a lot of information from you that will help us then plan and dive into your intensive when you get here. We use two therapists for our intensives, and that allows, certainly for couples, each of you kind of gets one person that can be your advocate, can do one on one breakouts with you. If it's a larger family, you each uh, we kind of divide amongst you, and you each kind of have someone who is going to be there for you and is going to lean into who you are, what you're needing, and how we can best support you in that process. But together, we're coming to understand, challenge, maybe break some patterns, help get clarity on an issue. And so, for any issues that would actually be harmful to only have like a 50-minute family therapy session and then have a week or two in between sessions, come back, do just a little chunk more, and then have to wait, that's where the intensives can be the most helpful. So, with 10 hours across 2 days, and then a 1 hour follow up if you'd like. But 10 hours across 2 days, we actually get to have momentum. We don't have to stop the conversation and let life kind of creep back in, maybe even regress any of the work that we've done. And we get to really work through a couple different issues, a couple different conversations, and have the time to honor what is bringing you here. Now, coming to 10 hours of therapy doesn't mean once you leave, everything's different and changed. There is work to change patterns and to actually implement what you've learned. But we try to really make sure that we give a balance of psychoed and structure before diving into everything. We want the rules of how this can go well. And then we want some experiential support so that you guys can not just talk about things in theory, but actually have the hard conversations or do the meaningful work with our support. And so being able to step away from it at the end of day one, come back on day two, and you have 4 hours on day two where you get to keep working and you can address anything that might have come up the day before. So intensives are really great for anyone who maybe has scheduling issues, maybe family members live across state lines, maybe one of your work schedules is hectic, so it's hard to get continuous therapy. It can be really helpful if you have more of an urgent need. We do schedule 3 weeks out, so it can't be urgent, like I need resolution tomorrow. But again, that's because we do a lot of the deep understanding through our planning and assessments leading up to the 2 days. But an affair might be something really urgent that we don't just want to heal in little bits across time, but we really want to um, carve out the time and do it across 2 days or one weekend or whatever, and then have additional supports periodically afterwards. Some people will continue to have couples and family therapy maybe once a month afterwards, or maybe they need weekly afterwards, but still that 50-55 minute therapy window is more successful because we did the deeper work across the intensive. When would you not be a good fit for an intensive? Certainly, if there's active substance abuse, active suicidality, um, any like these are hard conversations. So any trouble with maintaining safety and um, being able to handle the work. If there was a recent hospitalization, we might not be ready for an intensive. And we also can't do intensives if there's active violence or threats of violence. That wouldn't be safe for the work that we're doing. If you have any other questions about here's our situation, would we be a good fit? We can certainly have a consult. We do free 20-minute consultations, which you can book online. We can't get into the therapy, but if you want to talk about a few of the logistics of what you would be bringing to the table and what you're hoping to get out of it, then that's what our consultation can do. And if we're a good fit, then we move forward. And then you always have the chance to stay on with one of us after the intensive if you wanted to. Otherwise, we provide a full aftercare plan, referrals if needed, and really send you home with not only your packet of activities, but some recommendations and aftercare work that could keep the momentum. I look forward to talking to anybody who wants to do the intensive. And as I mentioned, you can schedule that consultation online or you can email us at info@familysolutionsandwellness.com. Thanks.